morning. It is September the 3rd, and I am here for another shift. And so I thought I would vlog again today because today I have a different assignment. That's what I'm trying to say, different assignment. And it's actually, more eventful today than it was last time I did this. It is now 7:55. I got a report, and I will be back to tell you about my patients. All right, so I'm back. I have 4 patients. I have 3 vaginal deliveries, a C-section, and I'm getting another C-section here soon. I'm giving Lovenox today, so I have that going on. I have a person who's on MAG who will be coming off of MAG sometime today, and she'll be in this room that I'm in right now. I'm gonna set this room up. It's pretty much set up, but I just need to finish some things. My medications. These are the medications I'm giving today. I'm giving Colaces and Motrins this morning, and I'm giving a Tdap later today. Blood pressure, I'm giving Nifedipine. And this is pretty much how I set my sheet up. I'll just set up with the patient's names, when they delivered, and the medications that I have to give. We have report sheets. And so now I'm about to get started on my day. So I will check back with you to let you know how my day is going and what's going on. I will say this. I got report, and report in itself was fine, but when we would do our bedside reporting, I found that 2 of my patients who I followed, a certain nurse, needed pain medication. That's not a problem typically. However, they just did rounds at 6 o'clock this morning, and I went in at 7 to do bedside shift report. So why is it that these patients are not medicated? And why is it the nurse decided that she wants me to do it, which means I have to finish report first? So I've had to explain to these patients I'll be back in about an hour to give them their pain medications because we don't stop report unless it's an emergency. So it's very difficult to follow some nurses when they don't do what nurses should be doing. I hate following certain people because they always either not pass their pain medications or something urgent happens. I have one who has increased bleeding that I'm going to have to watch today, one who has increased blood pressures that I'm going to have to watch today, one who also is on Lovenox, like I told you. So I mean, it's going to be one of those days. It's going to be much different than it was on last Monday. So anyway, we'll see how this day goes. I'll check back. All right, I'm back. This is our medication moment right here. This is Lovenox that I'm about to give, 40 milligrams given sub-Q. Our patient, or my patient, has a history of pulmonary embolism and blood clots and things like that. So therefore she's getting this Lovenox injection, and she will be getting it here in a few minutes. For me personally, sometimes I let my patients do their own injections. It just depends on what's going on, but I'll watch them, obviously. So we will see, what it is that she wants to do. With this, you have to remember that we have that little bubble at the end, so we want to make sure we have that bubble before we inject, and clean our site and just kind of watch. She does have bruising all over her stomach, so bruising is known when you are giving Lovenox. That's our medication moment for today. All right, so it is time for a midday update. It is 12:15 in the afternoon. It is almost time for me to go to lunch, but I wanted to come and just kind of give you an update for the day. Again, this day has been great. I have no complaints about today. This is making me look washed out, but okay. Anyway, no complaints about today. So I have 3 vaginal deliveries, like I told you. 1 C-section who's going home. So I've already did my discharge teaching for her today. She's not leaving until later today, but my discharge teaching is done because I'm about to get a new patient. I'm about to get a new patient in the next, say, hour or so. And she is a post-MAG patient, which basically means that her blood pressures were elevated in the 170s over 110s. So she got magnesium sulfate to help keep her from seizing. So she had what's called preeclampsia, severe preeclampsia. So we were giving her mag sulfate. Now she's about to come off of that, and I will monitor her for the next 24 hours on my side. So we did that. Let's see what else has happened today. Let me tell you. So this baby daddy come up to me saying, you know, hey, can I ask you something? And I'm like, sure, what? She's like, he said, he shows me a picture of the baby that they just had. Does this baby look like me, or does it look like this man right here? I said, listen, you're not gonna get me in the middle of that. So I said, if you want to know exactly where, you know, get a DNA test done, you have to go to LabQuest, you know, done. So anyway, he's like, well, look, don't you? I said, well, you know, for one, babies can look like either parent or somebody like maybe a grandfather or a great grandmother or something like that. Sometimes it may not look directly like a either parent directly. And then he showed me a picture of his other child, and I'm like, look, you're not gonna get me in the middle of that. So I said, you know, I don't know. So I said, definitely go, you know, figure that out or whatever, see what you need to do. So when he pulled up the picture of the other guy, I ain't even gonna lie, that baby kind of looked like that other guy. So I'm like, you're not gonna get me in the middle of that. Plus, it's none of my business anyway. But, you know, the sad thing about that is he was really distressed about it. And I'm up here smirking, but he was distressed about it. And I'm kind of like, you know, this is really messed up, because if it is between two guys, you know, and I don't know, I just know he looked kind of hurt. So, but that's the reality of my life in the OB world, where sometimes the people who think they're the daddies ain't the daddies at all. We have had plenty of say Caucasian man and woman have a baby, and that baby is definitely mixed when it comes out. And I've seen that so many times. I'm like, oh my gosh, his baby is mixed. It ain't even his baby type of thing, and he thinking it's his. And I'm like, you know, it's just like that sometimes. Then I must be a magnet today, because this other man, other baby daddy, gonna come try to corner me and say, hey, you know, I just want to, you know, somebody I went to high school with talking about, you know, hey, you know, are you married and what's going on with you? And I'm like, no. First of all, no. Second of all, no. Okay, what do I look like wanting him who just had a baby? What do I look like? And if you up here already mess around on the woman who just had this baby, why won't you? You know, my baby is 7. I don't want no man who got a brand new baby. My baby is 7, so no, I don't want to be in the middle of that mess. Plus, I'm married anyway, so that's not even the point. Even if I wasn't married, no. So yeah, they hitting on me today, and you know, but outside of that kind of drama, it's been a great day. I'm just waiting on my patient to come over, and that's pretty much it. I've given, I've given, not Lortab. I did give Lortab today, but I gave a Lovenox injection, which I showed you. I gave a Tdap vaccine. We give our Tdap vaccines to all our moms who consent to them. We are worried about the pertussis component. Pertussis, or whooping cough, is where if the baby gets that, then it could be very, very sick. So we give vaccines, the Tdap, the tetanus, diphtheria, and pertussis vaccine, to our moms to protect them and inadvertently protect their babies until the babies get their own DTaP vaccine when they are 2 months old at their doctor's office, pediatrician's office. So I did do that today. Like I said, I discharged a patient today, and I'm waiting on my new admission to come. We have about, I want to say 5 or 6 patients in the back to come today, and that's pretty much it. So it's been, again, another good day. I need to stop all this complaining, because I'm having, you know, it's still early though. We got 6 hours left in the shift. But I'm having a really good day today. So we'll see how this day ends up. I will check back in with you a little later. All right, so I am back. The sun is in my eyes. It wraps up my day. It is now 18:05, and I just wanted to come and give you my last check-in for the day. It's been a great day. Hold on, let me find a place where I can get out of the sun. Okay, there we go. So it's been a great uneventful day, really. I did get my magnesium sulfate patient. She was on mag. I did get her around 12 something this afternoon. Let me get all over here. Hold on. All right, there we go. I did get her around 12 something this afternoon, and she's been fine. I had to help get her up to go to the bathroom, and we cleaned her up, and she did great. I have given just basic pain medications. But the one thing I forgot to mention earlier today is that I actually had a patient who has a birth plan. And so if you all don't know what a birth plan is, it's basically where parents, mom, whoever, basically comes up with a way in which she could be a part of the team and kind of govern how her delivery and her care is going to go once she has her baby. And this birth plan was so like crazy that even the doctor was frustrated with her birth plan. And she was told, or I was told, that she did not want to be asked about pain. So we're not supposed to ask her about pain. So the way I am, I'm like, okay, you know what, I have to ask about pain because that's part of our one of our national safety goals and initiatives. So I basically said, instead of asking her what is your pain number, I just simply said, how do you feel? And that way, if I ask how do you feel, she's either going to say, well, I'm in pain, or I'm tired, or I'm whatever. So that's kind of how I worked around that. None of her requests on her birth plan really impacted me on postpartum. So we didn't have any issues this afternoon or today, this whole shift. So it's been a great shift. I honestly can't say anything negative about this shift. It's been very productive. I got all my work done. I've had plenty of downtime where I had time to eat lunch today. Had plenty of time to eat lunch today, eat snacks. We have been enjoying this shift. Nothing really has happened that's negative. So let's see, what else has happened today? The birth plan. Nothing much. We have about 7 patients in the back to deliver, and that's going to come over on night shift tonight, so it's not going to impact me at all. I am now wrapping up my day. I've actually already did my charting for this afternoon. I've did my rounds already. I've refilled my water. You know what I want to talk about? I was talking about this morning. So this nurse that I followed, I found out that she has a habit of not refilling her water pitchers and has a habit of not passing her medications. I will give anybody the benefit of the doubt the first time, but it's not going to happen again. And matter of fact, she comes back tonight, and I'm going to have to let her know when we make rounds that you need to make sure your pitchers are filled and that your patients are medicated, because it was very difficult this morning to have to deal with patients saying that they were in pain and they wanted pain medication immediately while we were in the middle of shift change. And that's just difficult. I like to go ahead and do all my shift change, my report. I like to go eat breakfast if I can. And I still got to do all those things this morning, but that falls on you, the previous nurse. Always set your nurse up for success, not for failure. And so I cannot stand a lazy nurse, and that's exactly what she is. She's a very lazy nurse. And now that I've talked to other nurses about the situation, I found out that's what she does. And I'm not giving her benefit of the doubt no more. So next time she tries to pull that on me, I'm like, go ahead and give your medications. Go ahead and fill your water pitchers up. You're going to do that before you go. You can't sit there and, patients hadn't had anything to drink in 3 hours and it's your shift. That's not happening no more. So like I said, I medicated the patients, and everything was fine. So that'd be the tidbit for today. I wanted to talk about magnesium sulfate. So magnesium sulfate is something we give the patient I had today because of her blood pressures. So she had preeclampsia, and so what people believe is that magnesium sulfate is actually to lower blood pressure, but it actually has nothing to do with blood pressure. What it does is prevent you from having seizures. So we don't want her to become eclamptic. So she was on seizure protocol in labor and delivery. When you have a patient on magnesium sulfate, that is a 1-to-1. So that means one nurse has one patient, and she's caring for that patient their entire shift. At least here at our facility is 1-to-1. So we can't have them on postpartum because they're critical care at that point. Once they come off MAG, then we have them on postpartum. And my responsibility is to make sure that that those blood pressures remain low, that she is voiding fine, and I've already gotten her up to go void, and she's doing fine with that. That she can walk, that she doesn't feel lightheaded or dizzy. We check her DTRs, deep tendon reflexes, every 4 hours. And we just kind of monitor that blood pressure every 4 hours for the first 24 hours, as well as her output, because magnesium sulfate also causes urinary retention. So we want to make sure that she's actually putting out our minimum of 30 per hour. And so we have them void into, the hat, basically. And just to make sure that she is good to go on that. My patient has voided 900, I want to say, since she's been over here, and I got her at like 1 o'clock. So we're good to go on our output. So I have no concerns. I got her up walking. She's still on a clear liquid diet because she has not passed any gas yet. She's a C-section. Has not passed any gas yet. So I'm waiting on her to do that so we can change her diet to regular diet. I got her walking the halls so that she can, you know, increase her mobility, peristalsis, the whole nine, so that we can go ahead and get her on a regular diet so she can be less hungry, because this clears ain't cutting it for her, she said. So that's pretty much what has happened. My patients are all good to go. I've medicated everybody, and water pitchers are filled. I'm just waiting on night shift to come in so we can end this shift. So this kind of wraps up my day. It's been a great day. Nothing major has happened, which I like to keep it that way. But if I kind of enjoy doing these videos, so especially these, you know, these vlogs is very easy to do, and it doesn't really require a whole lot of time and effort. I just simply state exactly what's going on, being mindful of, you know, HIPAA and things like that. So if you definitely enjoy these kinds of videos, which it seems like from the views that you all do, then please thumbs this video up, because I will definitely do more of these when I come to work. I am PRN, so I don't work a lot, but right now I'm working one shift a week about, just to get some bills taken care of. So we have to do what we have to do. I got to pay for my regalia, like I said in the last video, which is over $800. So I'm just trying to get some shifts in. Plus the holidays are coming, so I need to go ahead and get some shifts in so I can start planning for that. Anyway, thank you for watching this video. Until the next time, you all take care.